In this course, more than 30 surgical experts from 15 subspecialties at the surgical department of the University of Hong Kong will introduce you to general surgical practice. You will learn about surgical conditions, screening, imaging, treatment planning, disease management, and surgical operations, medical advances, and many more.
Untreated brain injury can be rapidly fatal. For those who survive, we want to preserve function as much as possible.
The reason why we can offer emergency treatment for stroke patients is because when the blood vessel is blocked, not all the brain die immediately.
In general, for patients who have early disease, the outcome after treatment is actually very good.
Gastroesophageal reflux disease, or GERD, is a common condition which develops when the reflux of stomach content causes troublesome symptoms and/or complication.
Chest wall deformities are very common and can vary from mild to severe.
High level of thyroid hormones in the blood will speed up the metabolism.
The aim of screening is to identify pre-malignant lesions and to detect asymptomatic early-stage disease.
Endoscopy is a finger-like camera that goes through the mouth, the throat, the esophagus, the stomach, and the duodenum, visualizing any tumor or obstructing lesion.
Common procedures performed by vascular surgeons include open and endovascular repair of aortic aneurysms or dissection, extracranial carotid artery surgery.
With advances in stem cell research, scientists are hoping cell-based therapy will provide a new cure.
Virtual reality can be used for better preoperative planning, enhanced communication with patients regarding tumor location and relationship to surrounding structures.
The modern technique is to use robotic surgery to remove the entire prostate surgically.
Liver transplantation offers a ray of hope for these patients because it treats two conditions simultaneously.
Breast cancer surgery is aiming to achieve best possible results for women while restoring as much of their normal function and appearance as possible.